So you had a one-night stand, Jessica. And your newborn has just come into the world, bringing with it a whole new level of responsibility. It can be daunting to know where to start. How do you care for your newborn? What are some things that you should know about them? What do you need for your baby's nursery? To make the transition easier, here is an overview of what to expect during your first hours as a parent. Eating. Most newborns will want to eat every 1.5 to 3.5 hours, depending on whether you are breastfeeding or giving formula for your baby, and the time it takes for their stomach to digest breast milk faster than a formula bottle. Around 3 hours. Babies may suck their hands or fingers when hungry, turn toward you if stroked gently behind the earlobe, make sucking motions with their mouth open wide enough, so that they can slide in small bits of food at once without chewing too much, cry after feeding but be an indication of hunger. Babies expect burping during and after feedings as well, which most babies do spit up sometimes, so keep a cloth close by to wipe him/her clean. It's been noted that many new mothers regret not being able to spend more time bonding through breastfeeding due to misconceptions about what nursing entails. This is why we should support them in doing it. Diapers. Newborns have 6 or more wet diapers and 4 or more poopy ones each day. For the first week or so, your baby's poops will look thick and black or dark green. That's called meconium, and it's the substance that filled their intestines before they were born. After that's out of their system, their poop will become soft and runny. If you breastfeed them, they will have light yellowish, seedy-looking poop. If they eat formula, it will be firmer and tan or yellow in color. After a few weeks, the pooping slows down. Breastfed babies can go a week with just one bowel movement, while formula-fed babies should poop at least once a day. Crying. Crying is the main way babies communicate, especially in their early days. The cries can be hard to decode, but you can think about their schedule or surroundings to figure out what's wrong. If it's been 2 hours since they last ate, there's a good chance they are hungry. If they have been up for an hour and a half, they are probably due for a nap. Babies can also get bored or overstimulated. If it's not time to feed your baby, and they have a dry diaper, you can try a few other ways to soothe them. Tightly swaddle them in a large, thin blanket, to mimic how they were snuggled in the womb. Snuggle them to your chest and gently pat them on the back. Rock, walk or bounce them. Move to a quiet place and turn on a calming sound, like a fan or a white noise machine. Offer a pacifier, or help them find their finger or thumb to suck. Sleeping. New babies often get tired after being awake just an hour or two. The first few weeks, your baby will snooze about 16 hours a day, usually in 2 to 4 hour stretches, any time of day or night. Many will fall asleep while they're eating or sucking, and that's just fine. Yawning, drooping eyelids, looking away, fussing, and eye rubbing are all signs of a sleepy baby. Always put your child on their back to sleep, on a firm sleep surface, with nothing else in the crib or bassinet, just a mattress with a tightly fitted sheet. By the end of the first month, newborns start to fit their sleep into longer periods. But it will be a few more months before your baby gets into a predictable pattern of the morning, early afternoon, and late afternoon nap, and a longer stretch of sleep at night. Playing. In between all the eating, sleeping, and diaper changes, newborns have short periods when they're awake and alert. This is a great time to play with them. Your baby is learning the sound of your voice, the sight of your face, and your touch. Smile, sing, read, and talk to them, sway with them to music, make funny faces for them to imitate, and offer interesting objects for them to feel and look at. At this age, babies don't need toys. Your face and eyes, your baby's hands and feet, and simple objects like a rattle, shatterproof mirror, or colorful scarf will offer plenty of entertainment. This is also when you can introduce your baby to tummy time. A few minutes of playtime on their belly each day will help them build stronger head and neck muscles and work on the coordination they need to roll over and crawl, some of the next big milestones they'll reach. Thank you for listening to my TED Talk. For more health and life-related content, like and subscribe to Better Health.